And good Wednesday morning, 3 minutes past the hour of 10 o'clock. We're up to 52 degrees right now at the KRIM studios on West Frontier in Payson. Glad to have you along this morning for another edition of Community Spotlight on KRIM. And this morning, there's certainly been a lot of talk everywhere these days about the coronavirus pandemic and the various challenges that has brought along. The bottom line is that the folks with Gila County Emergency Management have been doing a great job to help get the vaccinations out for folks. And we're going to be talking a little bit about that today. As a matter of fact, we have Michael O'Driscoll, who heads up the Gila County Health and Emergency Management Department. Along with him online, we're doing a Zoom call. We have Todd Whitney, Stella Gore, Josh Beck, and in the studio here, we also have Gila County Supervisor for District 1, Steve Christensen, with us. So first of all, thanks to all of you for being here this morning. We appreciate you being around. Thank you, Randy.
Thank you, Randy.
You bet. And now, Michael, first of all, from the emergency management perspective, this has got to be quite an interesting logistical feat when you look at trying to get, vaccinations out to a vast number of people in the shortest amount of time. I mean, that's there's just a lot of logistical hurdles that I'm sure you're struggling with right now.
Yes, it's, we've never seen this in our lifetime, how to get vaccines out in this type of quantity. So there's a lot of complications with this logistically. So starting with the amount of vaccine that we are receiving, there's a shortage in the entire country. Arizona is part of that shortage as well. So the amount of vaccine that we could administer, we're not getting the volume that we could get out to the public and the residents. So that's frustrating on our end. Another complication that we're seeing is this vaccine requires 2 shots. So not only do we have to, output the vaccines and administer the vaccines that we're getting for first shots, we also have to plan clinics for second shots at the same time. And you can't overload your resources that you have and the people that are helping us and volunteering to man those all the time. So those are the 2 logistical hurdles that we have to overcome across the country and in Arizona, and in particular Gila County, because our allocations change weekly, which is another struggle. We can go from 1,400 vaccines being given to us by the state, and a couple of weeks ago, it went from 1,400 down to 300. So it's difficult to plan clinic when you have this fluctuation in the number of vaccines that we're receiving each week. And we have not had 2 weeks in a row where we received the same amount of vaccine. Mm-hmm. And also what the CDC is doing is if the local health departments in the states are not administering the vaccines quickly enough, they're also reducing the vaccines to those states. I believe Nevada was just announced that the state of Nevada was not going to get an allocation for the next week because they were inefficient at getting out their vaccines. But in Gila County, we are doing a great job. We're leading the state. We're one of the top counties in the state with the vaccine allocation percentages. And just to give you an example, we're at right now in Gila County, we are, by the end of this week, by the end of Saturday, we will have 86.5% of all the total vaccines we've received. We'll have those in the arms of the residents of Gila County. So Todd Whitney and Command Solutions 4, my staff, all of our community partners, Banner, Dr. Michaels, MHA, Cobra Valley down south. We're just working with so many partners to get this out to the public. And I know it's a little frustrating because we do have a limited number of vaccine and we're trying to do the best we can to get more from the state. I've officially requested twice now for increased vaccination allotments, and I've been granted those. So we are getting a good number of vaccines in Gila County, and we're doing a bang up job getting those into the arms of the residents.
Now you've got quite a significant vaccination blitz going on this week, and with multiple locations right here in Payson for folks.
That's correct. We have the Gila County Health Department is running clinics out of the Payson High School Dome Monday, Tuesday, Wednesday. And so this week we are administering the health department. And Todd Whitney has set that up with his team. We're administering 330 second doses and 330 first doses. And then on Thursday, Friday, and Saturday, we have Ponderosa Family Care with Dr. Michaels. They're in partnership with Kenny Evans and the MHA, and they're holding clinics, and they're going to be administering 800 first doses on Thursday and Friday, and 300 second doses on Saturday. So we are really doing a heck of a job for the Northern Gila County this week. And also, not to discount the South, we have Cobra Valley who are doing daily clinics for us. And Thursday, Friday this week, the Gila County Health Department is down in the South finishing up the second doses for the Group 1A, Group 1B teachers and daycare workers down south. So we got clinics, and sometimes 2 clinics every day in Gila County.
And so there's a lot of moving parts to this whole equation. I know you brought along some of the county staff members who have been helping with this. Give us, if you could, kind of the Reader's Digest condensed version of who we have with us today and what their activities are as it pertains to all of this.
Sure. So we have, I have my 2 deputy directors, Paula Horn. She's in charge of our clinics, and she's in charge of receiving the allocations of vaccines, transporting those to our partners around the county. I have our other deputy director, Josh Beck. He's the epidemiologist for this pandemic. I have Stella Gore, who's the manager for our contact tracing. We have approximately 10 contact tracers right now who we still have to provide the tracing required by the CDC and the State Health Department for all positive cases, and making sure people are quarantining. And then I also have our incident commander, who was, if you may remember, Todd Whitney. He was our emergency manager in Gila County for several years,
right,
and accepted the director of emergency management position in Coconino. And we decided we need him back for this pandemic. So we got him here as well. So we're very lucky to have him.
All right. And if you don't mind me asking, Todd, you've been looking at disasters from a number of different angles, and certainly this one, coming in, front and center right here in Gila County. Again, I would think the logistics have got to be quite an interesting task to just deal with getting the vaccines in, getting them out quickly, and trying to manage that. And I think we may have lost Todd there. There comes Todd.
I'm here, sir. Yeah, thank you for that time. Yeah, truly a logistics hurdle, but we got a great, strong team. One aspect of, and Michael hit on this, how many vaccines will we get next week? We allocate or we request from the state a number, but as we've seen in the past, that number is not always what we get in the mail. So we have to schedule a clinic when we get vaccine in hand. And then with scheduling it, it's the promotion of it, it's securing the site, preparing the staff, making sure we have all the incidentals from sharps containers, needles, and making sure we have nurses that are ready to go to be, whether it's here. Right now, I actually am at Majestic. We pulled this clinic together late last night after we heard their clinic through Walgreens didn't pan out. So again, a lot of moving parts and pieces on planned events, but the project I'm working on currently was one of those unplanned events, and we just we turn on a dime, we pivot, and we just continue to march on. As long as we're moving the ball forward, it's a good day.
And to that end, I know some of the information that I received this morning is initially, and correct me if I go astray here, but initially, a lot of the vaccination dissemination today was going to be happening over at the LDS Church in Payson, but as a result of some kind of iffy weather, that's been moved over to the covered parking area just off the west entrance to the high school off McLean there, and I'm being told that that's going on from 9 until about 1:30 today. Again, that change in location due to safety and weather concerns at 301 South McLean rather than the LDS Church. Also, I understand that essential workers and those 75 or over can also walk in at the County Health Building, which folks in Payson may remember is the old Napa Auto Parts Building. And it's all been rehabbed, and that's right next door to the Gila County Jail. And then also at 431 South Beeline, another location there where people can get vaccinations as well. So, man, you get all kinds of different people involved in this. Michael, maybe how do you bring all of these different folks together to accomplish what you're doing here? I mean, it sounds like Gila County is really, as you mentioned, kind of leading the state, which is a bit surprising for little old Gila County, but you guys are doing a great job. Obviously, a lot of players involved.
It's very complicated. There's a lot of players. There's healthcare, there's businesses, you name it. It's been a tremendous undertaking. One of the things I'm blessed with is I have a wonderful management team, and my staff, they're putting in 12, 14 hours a day to make this work. We're out in the community, we're contacting everybody. We're asking people for help, and I would like to just extend my gratitude to all the volunteers we have. We have the Northern CERT, we have volunteers down south, we have the MHA, we have the LDS Church. It's not just our staff, and it's not just the people we hire. We are getting a lot of volunteering from the community, which is how this has to be done. Little old Gila County Health Department, I have 2 full-time nurses. Can you imagine 2 nurses trying to vaccinate 50,000 people? It's impossible. So we ask for help, we ask for partnerships, and Gila County, across the entire county, everybody's been so gracious and stepping up to help us through this pandemic.
Outstanding. And, here in Northern Gila County, I know that there was some big testing blitzes that were done, largely facilitated, I believe, through the MHA Foundation, Kenny Evans and that group, as well as Ponderosa Family Care, Dr. Michaels and his group. And that had been being held over at the LDS Church. But obviously, there's some folks that are into this more than just a one-time shot in the dark sort of thing. I mean, they're really partnering up effectively with you.
They certainly are. And in order for Gila County to get through this pandemic, and for any resident who wants to receive a vaccine, we have to partner with everybody. We just can't do this alone. We have to move forward as a community. And that's what we're seeing. It's frustrating for people, I understand, because we just don't have enough vaccine. And when people want a vaccine, and we have to tell them, you might be part of group 1C and we're in group 1B, you have to wait a little bit. And I get it's frustrating, but I do want to assure people that we are advocating for the residents in Gila County on a daily basis with ADHS. I keep asking for more vaccine. They have given us additional doses above and beyond what we probably should have received, because we are so effective at getting the vaccine out there. So it is a large community project, is what I like to call it, and I'm so grateful that people are helping us.
And as I mentioned earlier, with us in the studio, we also have Steve Christensen, who was recently appointed to take the position of District 1 County Supervisor after the passing of Tommy Martin. And Steve, what an amazing time for you to take this the seat as County Supervisor for District 1 in the middle of a pandemic. This has got to be some interesting new twists and turns for you.
Yes, I'm very honored.
There's an understatement.
Yeah. Well, first of all, I'm very honored to fill the seat of the Honorable Tommy Martin, and just really work for the people of Gila County. So I'm excited to do it. Mr. O'Driscoll is an expert in what he's doing. I commend him, his staff, all the volunteers. I consider myself an expert in training. So that's why I'm here today. I want to learn about what's going on as well. And I have a lot of catching up to do.
There's bound to be a ton of that for everybody. Now, also with us, again, if you're joining us on Facebook Live, you're not joining us on Facebook Live, but you will see all of this on Facebook here soon, as we're orchestrating a lot of this using a Zoom meeting. But also with us is Stella Gore. And Stella, tell us a little bit about what you've been doing as it pertains to all of this, and what kind of things have been keeping you busy.
Well, I'm in charge of the disease investigation team. So currently, as Michael said, we have about 10 investigators, and we contact them as soon as they have a positive test. We do an interview with them to find out their symptoms and onset. We find out anyone who was in close contact with them so that we can still continue to quarantine and isolate. Hopefully this vaccine is a light at the end of our tunnel, but unfortunately, there are still people out there testing positive, and we need to keep our community safe.
And when it comes to those investigations, I mean, that, people may not realize it, but there's a lot of twists and turns to that, because you have to, I'm assuming, and correct me if I go astray here, but you need to be looking at, okay, once someone tests positive, then you got to run down the trails of who all they've been in touch with for the past X number of days, and try to come after it from that angle, correct?
Correct. Yes, and you are correct when you say sometimes it can be a winding road, especially when you have children who go to school and different people that are waitresses or work in grocery stores, and at that time you have to determine what risk they've put other people in accidentally, of course, not knowing, and who exactly needs to be quarantined, and who we need to continue to monitor for symptoms.
Right. And also with us, a familiar name, Josh Beck. First of all, Josh, appreciate you joining along with us this morning. Give us a little perspective on, what this all looks like from where you sit and the work that you have to do.
For me, honestly, I guess, to reiterate what Michael was saying, part of what's been nice is we've really focused on the hiring internal local people over the last few years and bringing them up and kind of teaching them the ways of public health. And with that, when our emergencies like this happen, a lot of Michael's time really kind of gets spent on the political, the phone calls, the constant meetings with the State Department of Health, which is really where I'm personally thankful that we were able to bring Todd back on, because as you can imagine, a lot of my time being the person on the team with the background in communicable disease and anatomy and physiology, a lot of my time is spent doing the research and trying to keep up with, as you can imagine, what is almost daily research articles and stuff that are coming out about the vaccine, about testing and different tests and how effective they are, and just keeping up. I manage the work that Todd and our other consultants are doing, as well as Stella, the disease investigators, and contact tracing. So as you said, there's a lot of moving pieces to this puzzle, and what's been nice is the way our team's kind of put together with Michael taking on that, the higher level directing role. I've kind of put all the pieces in place under me, and having Todd and our current emergency manager, Carl Melford, we kind of have a little more expertise than what a lot of the rural counties have, by having, 3 directors, 2 emergency managers, and that experience Todd had in Coconino County has kind of really benefited us. So just a quick tangent, one of the things that's made this emergency a little different from most of the emergencies that happen in Arizona is that typically the Department of Emergency Management runs all the emergencies. And with this one, the public health at the state level has really taken on the primary role. And a lot of us public health people, we stay in that public health lane. So bringing on someone like Todd and having Carl kind of gave us the advantage over a lot of the other counties, because they knew much better how to work with the state on bringing National Guard out to help us, getting us additional funding and reimbursement for funding for things that the county's already spent money on, like PPE. So, part of the reason we were able to be number 1 in vaccine distribution was we have that foot in front of everybody as far as having a complete team from the emergency management side and the public health side.
One of the other aspects of all of this, first of all, I was just noticing that here about an hour ago, Michael, Gila County Health and Emergency Management issued an information release that says it is with great sorrow that our local public health investigators have confirmed 5 additional deaths in Gila County that have been attributed to COVID-19. 4 of those cases were residents here in the town of Payson. 1 was a resident of the city of Globe. And I know you put these reports out every day. one of the things that I've found interesting is following this from the early days last year. It seemed to begin with, at the very least, there was some misinformation, or at least in my estimation, disinformation that caused a lot of this to get politicized, where some people were thinking, oh, this COVID is not real. It's don't worry about it and all that. And I think most of us now have, I know myself personally, I think I know 6 or 7 people who have passed away as a result of complications from COVID-19. And I lost count at about a dozen people that I know personally that have, struggled with this, including folks in my own family. So has that been a challenge for you? I mean, am I off base in saying that it seemed to take a while to get people to perhaps realize the magnitude of the challenge here?
Well, I'll give a couple comments and then turn it over to Josh for his perspective too. This is a very deadly disease. We are seeing a high number. I believe we have over 130 non-tribal deaths in Gila County so far. This disease targets the higher risk health individuals out there. And it did take a little bit of time for the research to let us know exactly how this is transmitted, how to stop, not really stop the transmission, but cut down your risk with social distancing. We're still learning a lot about this. We have a couple new variants that are out there as well that we're concerned about. So it's just a very deadly disease. We don't want to see anybody in Gila County die from this virus. And the best advice I can give is please social distance and wear your masks and do the hand washing. It's going to work. It's going to reduce your risk. And if you're in that higher risk category, please make sure to take those, wearing a mask when you go out. We're required to go out to food facilities, and the host and hostess of these restaurants are required to wear masks. If you see that, give us a call. We will send out people to make sure that those are enforced. Those kinds of things can prevent you from getting this virus, because we don't want to see anybody in Gila County die from this. And I know, Josh, do you have any thoughts about this virus?
I suppose, when we're talking about the deaths, it's just, I suppose the saddest thing that happens when this goes on for, we're up to almost a year, is that, as Randy said, those numbers become just background noise after a while. And you would keep reminding that, in those older age groups that can't protect themselves, if you're 75 or up, it's 3 in 100 or 1 in every 33 people. And, that's a lot. And seeing those deaths every day, we don't want that to ever become a mute point or something that we just become used to, because it is something that we can prevent. And I suppose, from my opinion, the most complicated challenge we have now is not getting 60% of the population vaccinated, which is what a lot of the surveys across the country are looking at right now, is that there's, roughly 60% in general of the population that's interested in the vaccine. And we know that it's going to take much more than that to make this go away, where I think Dr. Fauci is currently saying probably 90-95% of the population needs to get vaccinated. Either way, whether it's, what we've seen with a lot of other diseases or what they're assuming, we're at least over 80% that we need vaccinated. And that's a good 20-25% of the population that we have to convince that these deaths are real and that we need to get that vaccination percentage up, or we kind of push the limit where we're just challenging the disease to continue to form new variants and make our job more complicated and continue to put those people at risk that are currently at risk.
Makes sense. One of the things, because I know we're running short on time, and I want to make sure that we get this out. As I understand it, and correct me if I'm wrong here, Michael, but as I understand it, you're still in the phase 1B, which is essential workers and those 75 years of age and older. Is that correct?
That's correct. And this is a great example of the community pulling together to help everybody out. So what we have is down south, Cobra Valley is doing group 1A, and they're also doing group 1B, 75 and older, while Gila County Health Department reaches out to the essential workers in group 1B. And then up north, we have Dr. Michaels, MHA, and Banner doing group 1A and 75 age group and higher. And the Gila County Health Department is also working on the essential workers. So it's sort of a three-pronged attack to get through Group 1B as quick as possible. And then the next group we'll move into once we see a reduction in the 75 and older group, we're going to move into the 65 and older group. And hopefully that will be in a couple weeks.
Sure. And for folks that are essential workers and for folks that are 75 and older that may not be aware of how they can sign up to receive the vaccine, give us the protocol on that.
So there's, because every partner we utilize has their own appointment system, and they're also required by the state health department to input the data into the state system. We're all medical records. The governor has sent out an executive order which requires anyone who receives a vaccine in the state of Arizona, their records must be inputted within 24 hours after receiving that. So we have different sign-up systems down south in Cobra Valley. If you're in southern Gila County, you can call Cobra Valley at 928-402-2888. That's Cobra Valley. They will help you sign up for the vaccine. Banner does not have a phone number, but I have put out a press release. There is a link that you can click onto. They only have a limited number of appointments, and once those clinics get filled up, it can be frustrating because you get a message on your computer saying that there are no further appointments. And then we did have a glitch with our call center this past couple days. We have 8 phone lines available. We opened that up to the public, and we had such a large volume that it sort of crashed the call center. So what we've done is we're splitting up the call centers into the northern area and southern area. And the northern area call center is going to be the one that I put out in my last press release, which is 928-402-8888. That's for northern Gila County residents who need to have some information regarding COVID. And if you have questions about how to sign up for a vaccine. And let me pull up the number, Randy, that I was just given for, we have a new number down south, and that number down south is 928-402-4335. That number is for southern Gila County, and that will be activated by midday today. So we will have a total of 12 people manning the call center. We have MHA volunteers and Northern CERT volunteers up north, and we have my staff down south. And so between 12 people, I'm hoping we'll be able to, we're really trying to get to everybody who calls in. So.
Outstanding. Now, I know we're almost out of time here. I'm going to go a couple extra minutes here just so we can get all the way around the horn here. But one person we haven't talked to yet is Paula Horn, who's online on our Zoom meeting with us. And Paula, if you could just briefly give us an overview of your work and what angle you come at all this from.
Thank you, Randy. One of the things that I'm working with is daily communications with all of our partners to ensure that the vaccine are getting out and into the arms of our Gila County citizens. Because of the allocations and the fluctuation of those allocations, we have to ensure that their vaccination plans are intact so that we're utilizing every last dose, because there are sometimes we can get 11 doses out of the vials, and we will give 11 doses. So we're also working with our clinical team at the health department to make sure that we have enough staff to make the vaccine clinics organized, run smoothly for the citizens, while still obtaining that COVID-19 requirement of social distancing and wearing masks. So it's been, logistically, it's been tough because after your shot, you have to wait 15 minutes and, there's not a lot of room. So we've been working on how we can make that run a little smoother so that people are getting what they need, but still staying safe as they're getting their vaccines. So working with the call center on staffing and trying to make sure that people get the answers that they need. And I know that's one of the things that, all of our citizens want to know: where do I get my shot? When is it my turn? And we thank, the radio stations and, we use social media to make sure that people know when they're eligible to actually come out and get their vaccine. And we do thank people for being patient and the kind words of how encouraging they've been with all the clinics and the staff when they do get their vaccine. So that's kind of where we're at, Randy, and we appreciate your help with getting all the word out to our citizens.
Okay, we appreciate everything you all are doing.
Randy, I have one quick, I did get something incorrect, and I don't want to cause more confusion. I got the numbers switched around. So for our call centers, so the 8888 number is the Southern Gila County and the 4335 is the Northern Gila County. So I want to make sure I got that right, because we're in the middle of switching that this afternoon. So the 928-402-8888 is the Southern Gila County, and the 928-402-4335 is the Northern Gila County call center.
Perfect. Thanks for the clarification. No problem. One last thing real quick that I think needs to be at least touched upon, because I think it's a question in a lot of people's minds. I know my wife is an essential worker working in behavioral health, and she's actually had both of her first and second vaccination now. And I know from a few folks that have had the second vaccination that there oftentimes is a little bit of an after effect. I know with her, for like the 24 hours afterwards, she was feeling a little icky, but then was just back to 100% after that. Is that something that you've been hearing from others as well, that the second dose of the vaccine might set you back for a few hours or maybe a day?
Josh, I'm going to let you.
I was going to say, in the vaccine trials, the second dose had a slightly more side effects. Maybe you're getting less allergic reactions because we catch those on the first round, but the side effects of fever, headache, those type of side effects were a little, it wasn't a lot, but they were a little stronger in the second doses in the vaccine trials. And
the bottom line is it's still a heck of a lot better than actually contracting COVID-19. So
correct.
Get on out there and get your vaccinations. Again, we did receive word today that essential workers or those 75 and older actually can just walk in at the Gila County Health Department building here in Payson. That's the old Napa Auto Parts building next to the jail, and also at 431 South Beeline Highway. We're out of time, but I definitely would like to thank Michael O'Driscoll, Stella Gore, Josh Beck, Paula Horn, and District 1 Supervisor Steve Christensen for being with us this morning and giving us a little bit of an update on where we're at with all this. And the bottom line is thanks for all you're doing, because I can't imagine how much of a logistical nightmare this has got to be for all of you. So thanks for being out there on the front lines. Thanks for being with us here on the radio this morning. And let us know if there's anything else that we can do to help get the word out. Just know that we're happy to do it.
Great. Thank you, Randy. And just a slight correction, at our old Napa building, you could walk in and get assistance. We're not doing vaccinations out of that.
Oh, okay. Okay. So you get your questions answered and things like that?
Yeah, that's where
we wanted to make sure. Yeah, as I say, we wanted to make sure everyone 75 and up that didn't have access to email or computers could still get registered in the system without having those challenges of not being able to get vaccinated. So the MHA and the CERT teams and our team in the call center are there to help those people get signed up if they have any technology issues.
Perfect. And that makes perfect sense too, because we have we're heavily weighted, for the retired crowd here in Payson. So, and I'm sure a lot of those folks are probably not real web savvy. So this makes perfect sense as far as getting the services to everyone that needs them. Appreciate it again, Michael O'Driscoll, Stella Gore, Josh Beck, Paula Horn, and Steve Christensen. Thanks you all for being with us this morning. We appreciate it. And we've got here on the radio, got to get you back to more of your favorite music. Have some tunes coming up from Three Doors Down, John Hyatt, Three Dog Night, and a whole bunch more. But first, a quick look at Rim Country weather.